my name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today I have two guests. I have Dr. John Minadeo and JoAnn Manahan, and we're going to be talking about the emergency services at the hospital. Dr. Minadeo is the medical director of the emergency department, and he's also the president of the medical staff, and he's worked at the hospital for 15 years. JoAnn Manahan needs no introduction, but she's the nurse manager of NMC's emergency department, and she's been with us for nearly 40 years. Actually, she spent her first 4 years at the St. Albans Hospital prior to the hospital's merger. So thank you both for being with me to talk about emergency services. And I think we should just start right out and talk about what is it like in the emergency department. You know, how many patients do you see? What type of patients do you see?
Thanks for inviting us, Jill. It's a pleasure to be here with you. The emergency department these days sees probably between 500 and 600 patients a week. Some days of the week are notoriously busier than others, and some hours of the day are notoriously busier than others. That's a national trend across ERs across the states. Our patient population is from newborn until the end of life, 100 and whatever years old. Some people these days can be. So we see patients in all walks of life.
Great. So what about your staff? What's your staff made up of in the emergency department?
We have nearly 40 registered nurses in the department. We have 12 emergency department technicians. We have 5 different unit secretaries that rotate through our shifts. We have 12 emergency department physicians, 8 which are full-time, and then we have a complementary staff of 6 mid-level providers, nurse practitioners and physician's assistants.
Right, thank you. So there's sort of different varying levels of care. You've got the emergency department, and I know we have like an intermediate care, and then there's like urgent care. So what's the differences between those levels?
Well, I think, clearly for the emergency department, we're looking to prevent life-threatening, detect and prevent any kind of life-threatening or limb-threatening illness. I don't think that's controversial as to the need to go to the emergency department or the function of the emergency department. The question that sometimes comes is where do you need to go from urgent care standpoint or emergency department. Certainly we take care of any kind of illness or injury from minor to life-threatening. The urgent care really is there for the more minor injuries. The difficulty becomes what's minor and what's major. So sometimes chest pain could be just due to like a reflux or esophagus problems, but you don't really know that until after the workup. So I would say to people trying to think about which is the appropriate place to go, if it's clearly something that's a minor injury, then that certainly can be taken care of in the urgent care. If you're not sure, then the emergency department can help to distinguish between the two.
That's great. So what kind of gets you up, to do this type of work? Because when you think about it, it's other professions, you kind of know what to expect, but in your line of work, you don't know. So how do you prepare for the unknown and what might walk? It might be a sore throat, but it might not be. So how do you prepare for that?
Yeah, that's a good question, and so every profession, like you say, has its own stressors and is stressful in its own way. Certainly, we have our share of that, and maybe more than our share. And it's not for everybody. It attracts a certain personality. I think somebody who is okay with the unpredictable nature of the day, and some people actually prefer that than knowing exactly what's going to happen during the day. And so I think it attracts that type of person. And I think a big part that helps me is that knowing that you're working with a team. And so it's really a team-based approach in the emergency department where the nurses and the techs and the unit clerks and the docs are all, working together to manage whatever comes in, and they certainly come in surges. So there are times where it's, you can have a conversation with someone, and then there are times where everybody's running, and and then we kind of all decompress, and we're all going through the same thing at the same time, and there's a sense of accomplishment of getting through the other side, where we know that we helped some people get to where they needed to be and improve their day, and so that kind of recharges our batteries and relieves some of the stress.
I think we tend also to debrief within our own unit, which is really helpful for staff. Some of the devastation that we do see from time to time is bound to affect people, but if we work through that together also as a team, we find it to be very successful.
Yeah, and I know for the community is when they come through the door in that crisis, seeing some familiar faces, it's just sort of that gives that reassurance. So you really play incredible roles, in caring for our community. So what can the patient expect walking into the emergency department? Maybe not through an ambulance, and when they come in, what happens then, and then what's the wait look like?
Well, yesterday the wait looked terrible.
You never know, do you?
You never know. When patients present to the department, all they have to give is a name and date of birth, and that gets them into our system. And then they're seen by the triage nurse. And if there's an open bed in the department, our policy is we bring people in immediately. We call that immediate bedding. We try to eliminate as much wait as possible.
Absolutely.
On days like yesterday, we have a 13-bed department, and all of those beds were full, and there were 15 patients waiting in the waiting room.
Yeah.
So when something like that happens, we try to round on our patients frequently in the waiting room, make sure nothing's changing on their condition while they wait. That's a very unusual circumstance for us to have that many people waiting in the waiting room for any extended period of time.
Sure.
So our goal is always to bring them into the department as soon as possible, get them seen by a physician or provider as soon as possible. Our turnaround times are very important to us, while at the same time making sure that nothing's rushed, that we're taking into account all of the patient's condition.
Thank you. So some patients may come to the emergency department more frequently than others. So how do you care for those patients that may need other resources?
That's a good question. So, as we think about the American healthcare system, we do so many things so well, but yet there are cracks, and there are places and people that don't have the resources that they need, and a lot of times we see them. They end up in the emergency department because we will accept anybody that comes in the door for any reason, and so some of those areas are either access to care, so they don't have a primary physician due to whatever reason. A lot of people with low socioeconomic status, people with mental health illnesses that don't have the resources, are not connected to the appropriate resources, people with substance abuse, drug and alcohol abuse, and so we're trying to improve the resources for them at the emergency department and get them connected to the appropriate places, and so we have some new initiatives that we're rolling out to try to address that problem. One is we have a dedicated nurse social worker who sees the patients and helps them if they don't have a primary doctor, or if they're a homeless person, or whatever their needs are, who knows and is connected with the resources in the community and the primary doc's offices and other social workers in different parts of the community to try to help them. We're also embedding a mental health counselor in the emergency department to see patients who are there primarily because they're not getting their needs met through the system. And then we're going to institute a screening process for people who have drug and alcohol problems that we may not notice, or that we may notice, and offer them a way to get into therapy that they may be struggling with.
I think that's really important to wrap around that patient differently than just sort of sending him back home or sending him out, to make sure they're getting that next step to wrap around. So that's a great program.
Mm-hmm. Yeah, because we deal, we're mainly episodic care. So
Right.
when people come to the emergency department, we kind of have to realize that we have a limited time with them, and we're dealing with trying to ascertain whether they have any life-threatening problems, and then oftentimes when they don't, we send them back into the system in which they may not be well connected. And so instead of just doing that, we're trying to hopefully to secure up some of those transitions of care.
Excellent. Okay, so when I get home, I turn the TV on and I flip on and there's, some ER show going on. So is that really the real deal? And what's the reality? Because setting expectations, they certainly may be setting expectations how it all works. So how do you translate that?
It's just like
that.
In fact, it's more exciting. No.
It's more exciting.
Well, some of it surely does happen. We've actually had a wedding in the emergency department one time.
Whoa, a wedding!
Uh-huh. Yeah.
And so we have babies born. So there are the dramatic for sure.
So you've earned your stork pin.
Yeah.
For delivery.
But it's not an everyday occurrence as it would appear on TV. I think one of the other the myths that's on there is the resuscitation of patients. So the person who loses their pulse and essentially dies prior to coming to the hospital, the resuscitation rate is really, in reality, very, very low.
Okay.
But on TV, it makes it look like it's the opposite.
Yeah.
But and there's not as much romance as
I was wondering if you're going to mention that. Yeah, there's definitely a soap opera going on in the middle of those. So, well, that's great, and I think the service that you provide is really pretty incredible. But I bet you've seen some change. I mean, if you had your first 4 years in the other hospital, so what's been remarkable for you in your 40-year career?
Wow. I think when I started at the Northwest Medical Center Emergency Department was 1979, and we saw about 7,000 patients a year.
Whoa.
We didn't even have a doctor there all day long. We would rely on our community physicians to come in and care for our patients. It wasn't long after I started when we started having emergency department physicians who were really residents who were moonlighting in our department. And that was very interesting, very good time. But over the years, now we see almost 28,000, and actually we peaked at almost 30,000 several years ago. And through all of our initiatives of helping people find the right place to get their care, our visits are down to about 28,000.
Wow.
But we've added, many staff. I believe there were 10 nurses when I first started, and 2 physicians who used to switch every other night or do a couple nights on. And but over the years, we've seen a lot of changes in technology, which Northwest Medical Center is a leader definitely in keeping up with technology. We're a very high-tech, fast-paced, albeit small department in the state, but we are not lacking for the correct equipment or the modern new equipment that everybody else uses. So we're very fortunate.
And your staff, both of yours are top credential for your position. So
that's right.
It's
The
great.
other change that we've seen is the patients. So there used to be a lot more trauma, a lot more, but I think through public safety initiatives, through car,
Interesting.
airbags, we see a lot less injury and more illness. And the patient population is getting older. They have a lot of multiple diagnoses and multiple illnesses that they're coming in with. So they're more complicated medical patients rather than the trauma. We still get the trauma, but it's the proportion is smaller.
Much. Yeah.
Interesting. Interesting perspective there. So, when patients are waiting, I know obviously the emergency department, and you can actually see, you working. there. So when patients see folks sort of in the station and they're feeling, well, I'm waiting, any information you want to share to the public of why the wait and why you may be seeing folks there that may not be feeling busy, but kind of what's going on?
Well, I think the one thing to remember is that we don't care for patients by first come, first served basis. We take care of patients by the level of their illness or injury, so that more acute patients are seen more timely.
Right.
But sometimes it may look like the triage nurse is sitting at the triage desk and doesn't have a patient, but the requirements are that there has to be a nurse at triage all the time.
Sure.
So it may look like there's somebody sitting there doing nothing, and for that actual moment, she might not be interacting with a patient, or he, but they might actually be interacting with the medical record and entering patient information. So sometimes it does give a false feeling that somebody's not doing anything when they are.
Yeah, I thought that was important to kind of get there because there's so much going on to really support the care of that patient, waiting for lab tests or interacting with the medical record or making sure you have the right staff so they're getting exceptional care every patient every time.
That's right.
So thank you both. The time has just flown, but thank you for serving this community and being there and being so passionate about what you're doing. We totally appreciate that.
Thanks.
This is Jill Bowen, CEO of Northwestern Medical Center, and thank you for joining our program.